We can't wait. We cannot wait anymore. We can't wait 10 more years. We can't wait 30 years. This whole campaign is called We Can't Wait because all of the evidence that I will be showing you tonight has been known about vitamin D for years, and absolutely nothing is being done effectively about it. Our role, Grassroots Health role, which we'll be talking a little bit about, really is to help move that research into practice in a much faster manner. And I will be telling you more about what that is. This whole thing started with this. And for those of you that can't quite read the fine print there, Grassroots Health got started in 2007 after I found out while recovering from breast cancer treatment that, oh my gosh, there was evidence showing that you could reduce the incidence of breast cancer by at least 50% by having your vitamin D level up to about 40 nanograms per ml. I was stunned. And that evidence was presented by Dr. Cedric Garland, and I'll talk with you a little bit more about his role in this whole project. This I wanted to show you because it is so significant. There was a randomized trial done in 2007, or published in 2007, by Drs. Haney and Lappy out of Creighton University that showed a very clear 77% reduction in all cancers with a vitamin D level of about 40 nanograms per ml. The industry at large rejected the trial. They rejected the trial. Guess why? Because as a preliminary or as a study, the beginning objective of the study was not to say how much does vitamin D reduce cancer. The study's original purpose, as stated, was about calcium intake, but they found this finding about vitamin D and cancer to be so significant, that is what they chose to publish. It was statistically significant. It met all of the criteria for an absolutely beautiful study, but as I say, the industry at large chose to essentially reject it. What we have here on this slide right here is a combination of what we call the Lappy trial, which was that RCT, and the Grassroots Health data. Grassroots Health is now running a very large population study of more than 10,000 people around the world. We started this in 2009, and people have subscribed since. People that participate in the study do a vitamin D test twice a year, every 6 months. They fill in an online questionnaire, and our data accumulates and accumulates and accumulates. We now have 10 years worth of absolutely beautiful data and research stuff that I will be showing you tonight. Most of what I am showing you tonight to add to your research pool is research that Grassroots Health has done in combination with other RCTs. Again, our purpose is to move the findings of those RCTs into practice. What this showed very clearly, one of the things with the Creighton trial or the Lappy trial is they have people in that study who were 20 nanograms per milliliter or less. That number on the bottom there, those numbers across the bottom are serum levels. That's a blood test with vitamin D, goes from 20 to 40, et cetera. And the items on the vertical axis are the hazard ratios. But anyway, you can see that there are quite a number of points that are probably on that green line below 20. Grassroots Health has nobody below 20. Everybody that's in our project knows that they need to be 40. So we merged the Lappy trial with ours to see what does it show, because the Lappy trial had nobody really above 40. And here was that combination thing. And please look at the from 20 all the way up to at least 60. Those bands, those blue bands there, which are called confidence intervals, are really pretty close to that green line, which means you can rely on that data. It really looks good. Folks, this is 10 years from the Lappy trial. It happened 10 years ago. What's happened in the meantime? Not a bloody thing. The cancer groups are still talking about drugs. All of our health promotional work is all about what drug to take, and absolutely nothing about prevention, which is why we are launching this. We can't wait any longer campaign to do something about vitamin D. This is not as fancy a chart, but I had to show it to you, and it's really going to be a gift to Dr. Garland very shortly. He hasn't even seen it yet. This is another one of those kind of hazard ratios look, and it starts at 30 nanograms per milliliter on the far left and goes up to 100. What I really want you to look at is how steady that slope is all the way down. This implies that your serum level needs to be 60 or 70 or maybe even higher, and you're still getting a benefit, all right? The 20 is a crying shame because the 20 is what has been so far established by the Institute of Medicine as being okay. It's not okay. It's not okay for almost anything, and you'll hear more about that, not from me, from our newsletter maybe, but not really from me tonight. At any rate, there was a 66% lower risk by going from 30 to 100. This is data from our project. This is not anybody else's data. This is all data of our participants. There are 2,500 plus people in it, so there's a lot of people there. And again, those bands are very significant. So we continue to find that cancer is very much affected by vitamin D. If you're not already taking it, if you don't know what your serum level is, for goodness sakes, get it up there. I wanted to introduce you face-wise to some of the great people that we've been working with. When we first started Grassroots Health, our very first task was to go meet the key researchers in the field to say, what is the message that we need to be carrying out? Because we've got to know it, and it's got to be authoritative, so to speak. And these people we now have 48 researchers from all around the world on our panel that advise us, help write papers, and do all of that stuff. A couple of quick introductions here. The gentleman on the top left there is Anthony Norman from UC Riverside. He was the first vitamin D person I met. And Dr. Norman is one of the granddaddies. And by the way, every single researcher you're going to see here is one of the originals. All right? We have had the pleasure of working with the founders of the field. I am very honored to have had all these people on this panel. But Dr. Norman is a biochemist, and he was one of the people that laid out, here is what the vitamin D molecule looks like, quite a number of years ago. Dr. Cedric Garland is the one in the middle there, and he is the one to whom we owe great blessings. And Cedric, when you watch this, which I'm sure you will, are very, very, very great ongoing things. Dr. Garland is from UCSD, and he has worked with us for the last 10 years to help us look at the details of the studies that we are doing, and has been a godsend to all of us. These other people here, Dr. Haney over there on the far left is at Creighton, or was at Creighton University, and he was actually our research director for about 4 years. And he was a very, very well-known researcher, published hundreds of papers, and his last words to me, he died last year of all things brain cancer. I talked to him about a week before we died, and he said, Carole, anytime you need me, just call. This was the giving kind of human being that Robert Haney was. We very much treasured his participation. Next to him is Joan Lappy. He and Joan are the ones that put together that first cancer paper that I was telling you about, and we have continued to work with them. All across the bottom here is our team at the Medical University of South Carolina, and I'll tell you a little bit more about what we've done there. But Carole and Bruce did the original study on vitamin D and pregnancy, and we used their work to build a program which we call Protect Our Children Now, which Dr. Roger Newman implemented within his OB department of 3,000 women every year. And we were very excited about that. This I wanted to show you about a lot of conditions. A lot of people say, what does vitamin D affect? Well, this is just one list. The top title of this chart is Disease Incidence Prevention by Serum Level. And across the top there is what the serum level is in nanograms per milliliter. And you'll notice right down here, this is rickets. I choose that one to start with because 99% of rickets is prevented at 20 nanograms per milliliter. And as you look at the chart, even just quickly glancing at it, you don't see any of those other horizontal bars stopping over there, do you? No. So 20 is not enough for much of anything. Here, falls, 72% of falls are prevented by getting to 30 nanograms per milliliter. Different conditions do have different sensitive points at which you've done all you can do with them. It doesn't hurt to get higher, but for falls in particular and for bone health, 30 is about right, all right? And that's fine. This was the cancer study. The number was 77% prevented at 38 nanograms per milliliter. I rounded off to 40. I don't futz with 38 versus 40. Can't keep track of that. And of course, our recommended level, back again to this panel of scientists of 48 that I work with, I want you to know the hardest thing I've done in the 10 years I've done this was to get a consensus. We met with every one of them, and every one of them signed off on a statement saying the appropriate serum level for human beings is 40 to 60 nanograms per milliliter. They really did that. So anybody, anytime tells you that there is no consensus, say, I know of one, I know of a big one. 48 researchers from all over the world is a lot of people. This was a picture of, I'm just going to show you several kinds of pictures of different conditions and what they look like. This is a comparison of Inhane's data, that's the blue curve there, versus the red curve, which is GrassrootsHealth. The Inhane's is a very, very, very large study in the United States called the National Health and Nutrition Education or Examination Survey. It's been going on for years. The average vitamin D level at Inhane's is 22 nanograms per milliliter. That's the average pretty much across the United States, right? Our average within our group is 41 nanograms per milliliter. If you say, okay, what is the diabetes incidence in those two groups? Ours is 60% less, all right? By nothing more than vitamin D. Our populations were matched in terms of what their characteristics were, their height, their weight, and all of those sorts of things. So it's very significant with diabetes. Pain. When we very first started our project, and we still get them, somebody would enroll for the first time, and the phone would ring off the wall. Guess what happened, Carole? I'd say, what? That's what I said the first 5 times, all right? What? My pain went away. For the first time in my life, I have fibromyalgia, the pain went away. I have knee pain, it went away, or it was reduced. All of these things happen, and that's one of the other things about vitamin D. It affects some things that you can feel and many things that you can't, all right? But with pain, it has a big effect, and it happens pretty quickly. These people would call us within about 3 to 4 weeks, not 6 months, to tell us that there had been an effect. A 12% reduction may not seem like a lot, but it certainly was a lot to those people that were feeling that kind of pain. Notice that this was out of a sample size that we had of 5,800 people. So this is back again to this marvelous group of people that we work with. This, colds and flus, the really common stuff that we hear about all the time that you're supposed to take all of these drugs for. I have become, well, first of all, I'm a very healthy person. I've always been healthy. I've not taken many drugs in my whole life. But over the last 10 years, I've become really on the side of an anti-drug person. I have learned so much about nutrients and nutrition and all of those sorts of things. Here is a classic. The blue line at the top, or excuse me, the green one, is about colds. It said that 36% of the population who had 20 nanograms per milliliter or less got a cold. When you get up to 20 to 39, 33% had a cold. And when you got to greater than 40, 30% had a cold. That represents a 15% reduction in getting colds. Take a look at the line with flu. All right? The line with the flu says 14%, which is not 36, but 14% starts out with less than 20 to 11% to 8%, which is a 41% reduction. If you take a look at the benefit you're going to get out of a flu drug, guess what? They never make that. And this has, to the best of my knowledge, almost zero safety concerns. So at any point in time that you are concerned about the flu, which everybody actually should be, make sure your vitamin D level is at least 40 nanograms per milliliter. This is one that I found interesting. Again, this is out of our data about broken bones versus serum level. All right? You remember that other chart I showed you about falls? There was a 72% reduction in falls with a vitamin D serum level of about 30. Well, guess what falls tend to do? You break bones, right? So this is related to that, but what I find really interesting on this one is you can see that it starts out kind of high, and then it kind of comes down to where it's 1.8% and 1.6 and 1.6. Where that curve finally changes there is right about 30 nanograms per milliliter. So those broken bones correlate very beautifully with falls. Again, there is a level there which is lower than what we need for cancer and everything else. So I'm not going to challenge my cancer history by having something that low. But that is what shows in our study. And again, these were what they call statistically significant. Another topic, pregnancy. We have been working nonstop on pregnancy, amongst other things, for the last, 3 years, 5 years. And when we first started out, my focus was almost entirely on cancer because of my experience with it and because I knew it was very significant. The more I traveled around the country, the world, talking to various cancer groups, the more discouraged I got because they were not ready to take action. They would not. And in some cases, they wouldn't even talk to me. And so I sat back as a business person, as well as a nutrition-oriented person. I sat back and said, who cares? Who cares? It's kind of equivalent to who can I sell my product to, all right? Who cares? And then I said, pregnant women care. Pregnant women care. They care about their babies, they care about their health. Maybe there's a chance there. And believe it or not, that was right at the time that Drs. Hollis and Wagner published their first pregnancy study in 2012, all right, which said that there was a significant reduction. Up here, in a number of conditions, which I'll highlight. Again, the recommended level for pregnant women is 40 to 60 nanograms per ml. And what we see here on those bars down the thing is you can see on the left column there, preterm birth, and their study was reduced by 47%. The next one, hypertensive pregnancy disorders, by 83%, all right? And the one that I really like the best, oh, there's a depression one there, all right? The depression within pregnancy by getting to about 46 was reduced by 39%. Impaired muscle strength was totally solved by getting it up to 30. I have to tell you what that impaired muscle strength means. That is the muscle of the uterus in order to expel the child. If the muscle in the uterus is not strong enough, the child or the woman has to do a C-section. And so by getting that there, you are in essence helping that woman and that child avoid the tragedies of a C-section. It's big. Postpartum depression also is helped, as I mentioned. And then down here, I'll come back to that. Down here at the bottom 5 or 6, really are serum levels of the child, all right? And it shows that the size, the small for gestational age, problem went away. The common cold was not so bad. Ear infections, lung inflammation, asthma reduced by 27%. There have recently been studies on asthma in particular, which show that if you get the serum level up to 40 nanograms per milliliter, are you ready? Asthma is reduced by 80%. 80%. This is a tremendous pain for that child, that family, for a long period of time, as well as being a tremendous cost. So all of these things are a result of that first RCT that Hollis and Wagner did. This, what we put together was actually, I'll call it a field trial, but it's a population study. We said, hey, everybody, we have this RCT which says that you've reduced all of these things here and nobody's doing anything about it. Same thing we always hear, all right? We want to put it into practice. We want to have 100% of your pregnant women who come in the door get a vitamin D test and get supplemented until they achieve 40 nanograms per milliliter. That's the goal. And lo and behold, Dr. Roger Newman at the Medical University of South Carolina, which is a state school, it is a very large place. They have about 3,000 births a year. He said, yes, we'll do it. Now, one of the big advantages, of course, is he was at the same place where Hollis and Wagner did their study. So he already knew something about vitamin D. It wasn't a secret. He wasn't scared of it, so forth and so on. So we put together, Grassroots Health actually spent 3 years from 2012 to 15, putting together a toolkit. Because if you just walk into a hospital and say, hey, here, implement this, what comes next? You have to design a protocol. You have to get all kinds of approvals. You have to figure out what educational materials you're going to have, et cetera, et cetera. It is a big job to get ready to implement something. So we, Grassroots Health, put all those pieces together for pregnancy. So all Dr. Newman had to do was to say, do it. And he did it. I don't really mean that's all he had to do. He actually had to do a lot. But what we showed, and we have just published our very first paper out of 2 years of that, all right? What we showed there is if a woman was less than 40 nanograms per milliliter compared to those that were greater, there was a 60% lower incidence of preterm births. And preterm is defined as 37 weeks or less. And for those of you who ever pay attention to p-values, it was a p-value there at 0.006. That is very significant. And we are continuing to gather data, and all we're doing really is adding zeros to the front end of that. The pattern is there. There's no doubt about it. This I wanted to show you. It has a lot of very exciting pieces to it. This is about the woman's vitamin D at birth for women with a history of preterm birth. Women who've already had one preterm are very, very, very likely to have another one, all right? So these women had that, and very preterm, take a look at the color bars starting from the bottom. Very preterm is less than 32, and over here on the far right, you don't see a single dot. Every single one of those women was above 40. In that middle thing, you see 1 dot, and less than 20, I guess there are probably 7 or 8 there. So it changes as the level gets higher. The same is true on the moderately preterm, on the late preterm. Over on the far, that's 34 to 37 weeks. There are 2, but look at how many there are in those less than 40, less than 20. Same thing at the top. There was an 80% lower risk of preterm births in these women who had already had a preterm birth by doing nothing more than getting vitamin D. It is more powerful, and we will be publishing another paper on this, than another drug, which is prescribed specifically to help women avoid preterm births. And we're very excited about that. A lot of people ask, and you might ask yourself about, what about toxicity? Is this there? Is it serious? And this study actually was done by John Hathcock in 2007. The study's old, but the data is still the same with everything they do. He showed very clearly that there was no toxicity in an intake kind of measurement if somebody's taking below 30,000 international units a day for a very long period of time. And even then, it's not necessarily toxic. On the other hand, what is the serum level? The units we're talking about, it's 200 nanograms per milliliter is where toxicity starts to occur. There is no way that we are recommending or seeing in normal course of events people getting to 200. It's a very unusual number. And to this date, almost everybody that has achieved any really significant toxicity with vitamin D, it's been a result of what is an industrial accident. They fortify milk, and in the process of fortification, instead of putting in 1,000 for something, they put in 1,000,000, all right? So all of the cases of toxicity were a result of some kind of industrial accident which came about, which somebody had to deal with. So in the levels that we're talking about, the 40 to 60, it really is also a physiological level. I didn't bring that slide tonight, but there was a study done of a native tribe that still doesn't wear clothes, and their levels were in the 40 to 60 range out in the open all the time. So it's a very, very, very safe level. This I wanted to show you for a different kind of reason. This was in a publication that we did back in 2011, or some parts of it were. Take a look at one of the biggest questions, I would guess, the most significant, most frequent question that we all get is, how much should I take? How much should I take? How much should I take? And our answer is always, I don't know. Depends upon what your serum level is. Get tested, find out. Here is why we say that. Take a look at that yellow bar that goes up around the 4,000. What that tells you is that an intake of 4,000 IU a day, international units, that red dot says your serum level might be about 10. I'm looking at the left column to get that number. And if I follow it to the top where the green dot is, my serum level might be 150. But my intake for every single person on that bar is 4,000 IU a day. So when you say, how much should I take? I don't know where you fit on that bar. I don't know how your body responds to vitamin D. And at this point in time, the science has some ideas about why. Weight is probably one of the biggest pieces there, but the biggest size is still like about 30%. There's a lot else that's going on there. In terms of other nutrients, a big player, believe it or not, is magnesium. Personal story, I've been taking 10,000 international units practically since I started to get to a level of about 60 nanograms per milliliter. I upped my magnesium levels significantly, and now I'm taking 5 of vitamin D. It made a big difference in my body. All right? So there are a lot of things going on with your body besides vitamin D. This is a chart that we put together to try to provide a little guidance to people who say, how much should I take? All right? It still depends on your knowing what your beginning level is, which is this column right here. And the little yellow thing going across is if your level is 20 nanograms per milliliter and you want to be at 40, you can start out with 5,000 international units a day and get tested again after about 3 or 4 months and see how it worked for you and adjust from there. This is all based on 7,000 plus people we have in our study, all right? And an average weight of 150 pounds. This, on the costs, number of cases per year, these are new cases, all thing, and new prices, new costs all down. And you can see there, very, 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 and these benefits, these dollar benefits and those percentages go back to the charts that I have shown you. When we are facing terrible times with our Medicaid budget, by the way, more than half of the babies born in the United States are Medicaid babies. If we could get to all the Medicaid population that's having babies and make sure they got their vitamin D levels up, we could greatly impact that Medicaid budget. Is anybody at the government level talking about that? Not yet, but we hope they will. At any rate, the costs are very significant. The savings are significant at many levels. So I put that there for you. This was just a picture to say, how do we do it? What do we do? What does it take to do this? And this is, as I mentioned, in order to implement a new standard of care in a hospital, you have to do a lot. You have to have the scientists and their information. You have to put together guides. You have to get participation, do education, analysis, and action. We have put together, and I'm very proud of our package, put together such a package, as it were, and it has gone through a very thorough test, as it were, at USC to see what else do we need to do. What does it take at the institution? You don't just walk in and say, okay, let's implement it. You have to have a leader in the OB department, somebody that says yes, somebody that will follow through when things aren't going right, that kind of person. One of the surprises I had with this, I did not realize that it was as easy as it is, really throughout the United States, for the director of the OB department to make such a decision. I really thought it had to go up higher. I thought they depended on more external bodies than they do. And it's totally up to them, and I'm very excited about that. We now have a list of OB departments around the country that want to do this. And the only reason we're not doing it for all of them is that bottom one there called sponsorship, which means money. We have to receive some kind of funding from sponsors to do that. Another thing that's very important is the institution has to be ready to do things like give us data. That sounds trivial, but something like 95% of all of the major institutions who have implemented big electronic health record systems have major problems, all right? And it shows when they are trying to give us data. A lot of stories there. They need everything we've got and more sometimes, and we need to have sponsorship. This is to take a look at, okay, fine, what do we do? How do we move this action plan forward? I start with the individual always. That's you. Make sure you do a vitamin D test at least annually once you get going, but at least probably 2 times a year to get yourself started. That's that simple. Looking at the community, what do you do? Well, there are 2 big things that we're ready to help do right now. One is you, right here in Encinitas or in San Diego area, take a look, what groups are you aware of or part of that are ready to act, to create some kind of action? We are going to do some walks for action, starting probably in January, and for awareness, to get attention to the problem, and obviously for fundraising as well. Again, back to the hospitals, identifying hospitals that you know or somebody else knows that would be ready to work with, and then we can visit with them and see how ready they are and get them going. With the sponsorship part, we need sponsors of all kinds, whether it's an industrial sponsor, a personal sponsor, a teenage kid who gets $10 for this and donates $5 of it to you. In order to make our work happen, sponsors are absolutely necessary. Thank you very much for coming, for spreading the word and being interested.